In my years of practice, I've actually only encountered true pancreatitis in small animals about 2 times. When we look at the biochemistry for pancreatitis, it does show elevated fat levels, but if you check other indicators, you'll find that for many cases of frequent vomiting or diarrhea, the other liver and kidney indicators are mostly normal, with no significant abnormalities. In terms of the complete blood count, it might just show a simple increase in white blood cells, which could indicate some dehydration symptoms. The doctor made the diagnosis saying, "This is pancreatitis." But this isn't really primary or idiopathic pancreatitis, it's actually secondary, caused by something else. It's essentially an acute gastroenteritis, which can involve bacteria or other factors. If the small intestine is congested, the duodenum swells. This swelling affects the duct. As mentioned, the bile duct and pancreatic duct share a common duct. If there's swelling at the source, then the bile or pancreatic fluid is affected. Poor drainage causes the pancreas to swell. You could classify this as pancreatitis as it causes inflammation, but it's not idiopathic. If we address the inflammation in the duodenum or acute gastroenteritis, when inflammation resolves, the drainage will naturally improve. Inefficient excretion can also indirectly cause the pancreas to become red and swollen, and you'll notice that the treatment period for this condition is relatively short. The symptoms are usually mild and the duration is quite short, often disappearing within 3 to 5 days. In contrast, true acute pancreatitis is really serious, even in human medicine. Acute pancreatitis can be life-threatening, and once it's diagnosed, the patient usually ends up in the ICU. This can lead to bleeding in the digestive organ. In pets, true pancreatitis can present symptoms similar to those in humans, such as vomiting blood and bloody stools, which are relatively common. It can cause pain, but we see elevated pancreatic indicators. In cats and dogs, you might notice a crouching position. If you touch the area around the pancreas, you'll be able to notice a reflexive reaction. The whole abdominal wall will, such as suddenly, tighten up. For example, a sudden and unexpected contraction. For true pancreatitis, it's crucial in clinical practice to strictly follow the fasting and no water guidelines. We need to give the pancreas enough rest to allow it to recover properly. This often requires specific prescription medications, including ulinistatin. Butorphanol is primarily used to treat pancreatitis in humans, as it is actually an extract of human urinary proteins. It can eliminate the excess amylase and lipase residues in the blood vessels through the bloodstream. Of course, it can also reach the pancreas through the blood circulation to reduce its secretion. So if it is real pancreatitis, it is necessary to use this medicine. Other pseudopancreatitis is caused by the so-called gastrointestinal tract. So we absolutely don't need to use this medication. That's why we need to perform some differential diagnoses, including using fluorescent reagents and observing specific clinical symptoms.